Okay. Yeah. Okay, so welcome everyone. We will just wait for a few more minutes and then we will start the webinar session lah. Right? So we just wait for like 2 more minutes and then for the others to join us. Oh, okay. So I think we will just start lah. Can you hear me? Can you hear me right? All right. So okay. So welcome. My name is Ian. I'm from the Division of Program Promotion. Okay, welcome to our live webinar. All right. So today our topic will be the digital revolution in healthcare, and we are proud that we managed to invite Dr. Vera as our speaker for this sharing session. Okay, so later on, once the sharing session is ended, there will be a Q&A session where you all can ask questions to the speaker, and there will be evaluation form as well. So make sure to fill up the evaluation form for us so we can be prepared for the next webinar next time. Okay, so before we start, let's have a look at the speaker's background. So Professor Dr. Vera is a clinical professor in the Faculty of Medicine and Health Sciences. Right? He holds a Master of Pathology and the Bachelor of Medicine and Bachelor of Surgery in University of Malaya. Okay, and his area of expertise are immunohematology, laboratory informatics, molecular hematology, um, sorry, and transfusion medicine and transplant immunology. Right, so without further ado, let's welcome Dr. Vera to the stage. So Dr. Vera?
Yep, thank you very much for the introduction. Yeah. Let me just get my screen started.
Okay.
Okay, yeah. So good afternoon, everybody, and thanks for joining this webinar.
Sorry, I think you need to share your screen first.
Oh, okay.
Yeah.
I am sharing it. So
yeah. Now it's okay already.
Okay, yeah.
Okay.
Okay, yeah. So good afternoon, everybody, and thanks for joining this webinar. So I assume that some of this, the listeners here will be young people planning on their next career move, and therefore I thought it may be useful here to talk about some of the ever-changing landscape of the practice of medicine and how digital technology in a broad sense is going to shape the future of the medicine. So by the end of this talk, I hope that the listeners will be convinced that medicine is an exciting field, and not only for those who want to be doctors directly managing patients, but also for many other professionals and practitioners in the field of mathematics, computing science, software development, and social sciences, just to name a few. So essentially, our lives nowadays have become increasingly digitalized, especially over the past decade. So unless you have chosen to stay off the grid, which is virtually impossible these days, nearly every single activity you partake in on a daily basis has a digital record or a footprint, often without you even being conscious about it. So imagine you wake up in the morning to your alarm clock and switching on the lights. That would be, if not now, in the future, will be controlled by AI-enabled agents like, say, Google Home or Alexa. When you get into your car and navigate through traffic using Waze or Google Maps, it's essentially tracking your every movement. If you are using public transport, you'll likely be using a smart card which will also be tracking the stations you're getting on and off. Surveillance cameras with facial recognition technology will be capturing your every move while you are in public. Your conversation on the phones are captured by apps such as WeChat and WhatsApp. And at the office, you'll likely be working on a computer that is monitored. And activities like learning, teaching, meetings, shoppings, and finance, making applications will all be done online these days. Even your leisure activities like watching a movie or listening to music is tracked. And of course, social media sites such as Instagram, Facebook, and TikTok, and search engines like Google know more about you than even your family members or close friends. Now, this progressive advancement in computing power, miniaturization, software design, network protocols, together with a much wider access to mobile computing and cloud-based storage, has led to these vast amounts of personal data being collected, analyzed, and utilized in multiple dimensions. And this has certainly led to disruptions of many industries such as transportation, hospitality, and finance. So the next major disruption that is going to be poised for a digital revolution would be healthcare. Now, there is a well-founded fear that the unbridled acquisition of personal information through our digital devices may lead to major violations of our rights and be used for malicious intent. Certainly, I strongly feel that it becomes dangerous when big techs such as Facebook and Google become richer and more powerful than sovereign nations. But that would be for another discussion entirely. What is more important, though, is that we leverage our current and developing technology and this capability to collect, to analyze and utilize the multidimensional interconnected data for the greater good of the individual and community. As so aptly stated there, technology is not to be feared, but it is only to be understood. And certainly the genie is out of the bottle and stuffing it back is not possible. So the seamless integration of healthcare related information of an individual from cradle to grave will be harnessed and will actually drive our individual self-management and patient empowerment. Now, personal health records are an important point as far as health management is concerned. Personal health records are an integral part of ourselves, and taking personal ownership of our own health records that is consolidated and portable is important for individuals like us to make personal lifestyle choices, empower self-care, and to seek appropriate healthcare services whenever required. If you were to look in the current scenario, your healthcare records are scattered among many healthcare facilities and doctors or healthcare professionals that you have visited. There is no easy way of you to track your entire healthcare experience and acting on it, either personally or if you were to go and see another doctor to get the health information prior to this. So in that case, tests have to be repeated and histories have to be retaken whenever you see a new doctor or a healthcare professional. If you change your healthcare facility, you're going to move, or you say you move to another place, you can't carry your previous medical records with you. And if you seek healthcare or move to, say, another country, it will not usually be possible for you to transfer your medical record. Now, all this is set to change with this current push to create this portable, integrated personal health record, which will be managed through automated interfaces. So these automated interfaces should be able to consolidate all your medical records and test results into a single platform. And you therefore can access your medical information anytime, anywhere through your personal digital devices. Of course, security and confidentiality will be an issue that needs to be tackled. Progress has also been made in leveraging blockchain technology for some parts of maintaining healthcare records to ensure its security while allowing consensual data exchange. Legislations and regulations are also needed to create this non-exploitative environment for personal, whenever personal health records is going to exist in the cloud. Personalized genomics is the other area that will see a revolution. Now, personalized genomics is becoming increasingly accessible. So the sequencing, the analysis and interpretation of the genome of the individual can be used to assist in predictive healthcare. So examples are discovering specific drug allergies in patients based on specific DNA changes, and this field is known as pharmacogenomics. I am a transfusion medicine specialist and work on using personalized genomic data to decipher blood groups to the molecular level. So in future, if you were to require a blood transfusion and an organ transplant, the blood or organ will be matched to you at a molecular level so that you do not react adversely to the transplant. The next big area of development will be using personal digital devices for self-monitoring of your health status. You already have Fitbit that tracks your activities. iWatch has apps to monitor your heart rate and rhythm as well as your oxygen saturation. There are glucose monitors that link to your devices and transmit real-time data to healthcare professionals. And diabetic patients now can have their insulin doses automatically adjusted and administered by a pump that is controlled by a continuous blood glucose monitor. The ongoing pandemic also demonstrates how important telemedicine and teleconsultations are in providing continual care to patients. So this is particularly useful for patients with chronic diseases who are homebound, or patients who do not want to or cannot visit a healthcare facility, like if they are in a remote location. So telemedicine is able to keep these individuals in contact with the healthcare facilities. Drone technology also makes it possible now to deliver medication, blood, and even cardiac defibrillators directly to the patient or the nearest healthcare facility. You also have virtual assistants, and virtual assistants will in future perform routine medically related administrative tasks like making a clinic appointment, reminding you to take your medication, or say fill a prescription at a local pharmacy, and that medication can then be delivered to you. In fact, such medical assistants virtually running on computer algorithms are already in use in Europe and the Americas. So it's also envisaged that sophisticated specialized chatbots will also be capable of aggregating various data, validated medical data, and useful information which can be aggregated and supplied to healthy individuals and patients alike. So such a setup using professional specialized chatbots would address concerns of fake medical news that is so commonly circulating these days online. So really, healthcare, digital healthcare creates a condition where one ring rules them all. Okay, so personal healthcare information through effective, intelligent integration to clinical and hospital medical records, personalized genomics, self-monitoring through wearables would be the important elements of preventive and predictive healthcare in the future. It would allow for greater individual autonomy and self-management, and it would drive self-management and self-empowerment and accountability of the individual to his own healthcare. The seamless integration of medical information that is obtained through these multi-dimensional sources will enable decisions and interventions to be undertaken in an effective and timely manner. In the long run, healthcare will drive efficiencies and cost savings as far as healthcare is concerned. Now, it cannot be understated that the internet is a primary source of medical information to a lot of people. Okay? About 7% of Google's daily searches are healthcare related, with over 70,000 search queries done every minute. Okay. And certainly, Google will have a way of getting into the action and taking a slice of the pie. We now have Google Health that has aspirations of aggregating all your medical data into one platform and making it universally searchable. Google Health will somewhat take the same path as I described earlier, aggregate inputs from your medical records, personal digital devices, and genomic data, and then provide actionable items such as developing predictive models, analyzing causation and correlations, and understanding human behavior. Google Health is not for general use as yet. It is still being tested out in several hospitals in the US at the moment. So the general goal of such data-driven platforms would be to facilitate medical advancement, to promote preventive care, and to improve the quality of life and life expectancy of each and every connected individual. Now, a very important aspect of digital healthcare is that it now places ownership of medical information to the individual. Now, this contrasts with the current state where the healthcare provider, such as the doctor or the hospital that you're visiting to, are the primary custodian of your healthcare records. And getting that healthcare records consolidated into a single place is still a big issue. Now, this use of this digital healthcare in this context fits in very nicely with the concept of preventive care and promoting the idea that the individual must take personal responsibility for their own health. Most diseases that we see today are lifestyle related: poor diet, lack of exercise, smoking, excessive alcohol intake are some of the factors that are associated with the common medical problems that we see these days, such as heart disease, diabetes, and cancers. So the need for preventive and proactive care is even more crucial now. The cost of disease treatment or reactive care is now escalating to unimaginable levels, and there will come a time when the government cannot cope with its population healthcare needs and budget. Therefore, a more proactive approach and preventive healthcare facilitated by incorporation of digital technology into healthcare is now even more imperative. Okay? To quote an unnamed source, we have to move from incidental healthcare to continuum-based healthcare. To do so, we don't need more technologies. They are already here. What we need now is a culture change with a focus on prevention instead of continuing to pump money into hospitals. I think our government is aware of this as outlined in our recent digital blueprint. And I do think digital healthcare will be a major thrust that we will be seeing within the coming decade. If we don't move, we are going to be left behind. So to recap again, some of the potential impacts that we will be seeing within the next decade in the area of digital healthcare. One would be on-demand personal healthcare records. So now you will have access to on-demand personal healthcare records, which allows you to carry your medical records with you. And this is what we would term as data portability. This, of course, the portability of medical data will drive the concept of Uberization of healthcare, where healthcare is brought to the community rather than the community going to the hospital or clinic. So for whenever you require a medical consult. So somewhat like a Grab driver here in Malaysia coming to you, only this time it would be a healthcare professional. And there are apps already in use at the moment to facilitate this Uberization of healthcare. Preventive and predictive healthcare based on aggregation of multi-dimensional data and then integrated and use of machine learning to analyze this data will foster directed health education to individuals. So correct individualized messaging and a proactive approach to healthcare can be provided in this context. Telemedicine, meanwhile, will improve accessibility to healthcare, and it will also help bridge the resources uh, which is limited to certain segments of our society once our society is fully connected. Other technological and innovations that will drive the digital healthcare revolution, such as wearables, personal health monitoring devices, will facilitate the real-time monitoring and just-in-time preventive interventions to be undertaken. So, for instance, an abnormal heart rhythm associated with, say, a heart attack may trigger an automatic alarm to the nearest healthcare facility, which can then send a medical team to the house or for immediate medical attention. Robotic surgery and the use of artificial intelligence algorithms are also being extensively investigated in the field of healthcare. Machine learning especially is set to transform many areas of healthcare, especially in areas of predictive healthcare, laboratory and imaging diagnosis, and outcome analysis. So integration of machine learning into existing diagnostic and care workflow is already in the process of implementation. So the use of machine learning tools will enable more rapid responses to healthcare information, and this will also enable quicker and targeted evidence-based interventions to improve patient outcomes. So the move towards digital healthcare is inevitable, especially within the countries with high and medium human development index with high connectivity. So internationalization, global mobility, and the rise of the consumer class is an important driver towards digital healthcare. I think the current pandemic, especially again, has illustrated how important integrated healthcare information is. And in future, we will probably be traveling with our health records on our personal devices and things like vaccine transport, vaccine passports that you will probably need to carry around, which are then recognized globally. Technological advances such as miniaturization and cheaper computing power, wider and faster bandwidth, especially with the introduction of 5G, the rise of mobile computing, and the move towards cloud-based and IP networks will feed into this framework of digital healthcare. Distributed ledgers or blockchain technology may also contribute further to address issues of security in relation to healthcare-related data. My special interest would be potential artificial intelligence applications in healthcare. Cheap and accessible storage, global interconnectivity, and big data consolidation have provided us the necessary data sets for developing machine learning algorithms, which are continuously improving. You now have deep learning algorithms that understand spoken words and written text, at least at a simple level. And this capability would further facilitate the capture of medical related data during a consult. Healthcare institutions are also continuously looking to improve efficiency and cost effectiveness. So the need to reduce medical errors, which are usually human related, automating repetitive tasks and having effective process controls will also drive the need for incorporating digital healthcare into medical practice. On the other hand, the consumer demands of the current generation of the highly connected, social media savvy generation requests requiring mobility, interconnectivity, self-empowerment will force the healthcare services in future to be digitally driven. Okay. Also, at the other end, the aging segment of the population also needs attention, and this can be brought through digital healthcare, particularly in the use of telemedicine or remote healthcare. Governments also must actively participate in this push for digitalization. The needs for transparency, open government, and private data sharing, as well as establishing legislation and regulatory frameworks, is crucial for the healthy growth of a digitally driven healthcare service. Let me just delve a little bit into artificial intelligence, or AI for short, which I'm sure many of you would have heard. So AI is an umbrella term that refers to the simulation of human intelligence in machines, essentially for them to think like humans. Machine learning, which is what is utilized for many of the healthcare applications, is a subset of artificial intelligence, and that describes computer models that learn how to do tasks based on the data that they are fed with. Rather than you having to program them, the current generation of deep learning methods essentially learn themselves based on the data that has been provided. So the machine learning's ability to learn from data makes it especially effective when data is complex or nonlinear and maybe beyond the normal human comprehension. In such a case, a human mind may not be able to sift through the complex presented data, analyze it, and find ways to best solve the problem, while a well-designed AI engine may be able to use information that has been provided. So the fruits of machine learning is, of course, everywhere these days. When you do a Google search, you look at a For You page on TikTok, or you classify photos on Facebook and iPhotos by facial recognition. When you perform a Google Translate, they are all driven by AI engines. Okay? Although these may be somewhat still considered as a relatively big AI. Strong AI is what is hoping to be developed in healthcare, and these are hope to carry on tasks that are much more complex and human-like. I guess the holy grail would be when artificial intelligence is able to learn emotions and express empathy, like the movie Her there with the Phoenix. Okay? That is a far way to go to actually replace the doctor itself, but nevertheless something to think about. So machine learning algorithms are now already being applied in complex tasks such as breast cancer screening, using mammography, where the artificial intelligence system was found to be comparable or better than human readers across study sites in both the UK and US. Of course, there are cases where the human eye would miss a potential cancer, and also where the artificial intelligence engine misses the identification of the cancer. At the moment, neither human nor AIs have been found to be 100% correct. The other potential application of machine learning is the development of artificial intelligence-driven, digitally enabled care pathways. Okay, these are what we consider as how we care for patients when they are in hospital. So this is demonstrated by a paper from the Nature, prepared by the DeepMind group, which describes a deep learning algorithm that continuously analyzes patient data to predict the risk of acute kidney injury in an ICU setting. And this algorithm predicted 90.2% of all acute kidney injuries that required subsequent administration of dialysis, 48 hours before traditional methods actually predicted the risk of acute kidney injury. So in the traditional approach, a laboratory result which is flagged as indicating a potentially serious condition, like in this case, you've got an acute kidney injury, will need to be communicated through several layers before the patient receives attention. So like here again, if you were to see on the top there, you have multiple steps of communication involving the nurse, the junior doctor, and the consultant before intervention occurs at the patient level, and this contributes to delay. Using machine learning algorithms, which is illustrated on the bottom part of this diagram, which would then flag abnormal results, and these can then be directly communicated electronically to the kind of caregiver, which will then expedite care delivery, which logically would improve patient outcome. Integrating predictive algorithms into computer-aided care pathways will likely become mainly mainstream within the hospital and laboratory information systems in future, where automatic alerts and data-driven advice can be generated automatically by the system to improve patient care and also to accelerate the time of delivering such care. The incorporation of machine learning into care pathways and clinical process automations will definitely contribute to reducing medical errors, which are not uncommon nowadays. Of course, in order for you to drive digital healthcare, the cornerstones for that would still be the requirements for a digital society with high connectivity. Broadband access has to be wide, fast, and cheap to enable participation by all members of the society. So a push for digital healthcare must, of course, be accompanied by the development and effective rollouts of broadband and mobile computing technology. 5G and new standards of communication will likely drive future growth. This may be an area of attention for Malaysia, as we still lag behind many countries in our access to high-speed broadband networks. Obviously, nothing is perfect and foolproof. Apart from the need for good, dependable, high-speed broadband coverage, digital healthcare has many issues that needs to be addressed and resolved before it can be widely utilized. I guess the primary concern of many would be the ethical utilization of individual patient health records once it is put up there in the clouds and consolidated. This is, of course, a warranted concern that needs to be addressed collectively and should involve the public, the industry, and governments. How secure is that information, and what assurance can be provided that the personal information will still remain confidential? Additional developments in encryption algorithm, cybersecurity technology, and distributed ledgers would hopefully address some of these concerns. Data is, of course, power, and when correctly used, it will yield many answers as well as interesting questions and solutions. And that would benefit the well-being of an individual and the society at large. So legislations, regulations must be in place to ensure that the personal information that is out there is not exploited and not used indiscriminately. Another concern, particularly in the field of machine learning, like text and image recognition, which is used for medical diagnostics, is the lack of good quality, large-scale data sets across diverse patient groups and conditions. Okay? The machine learns from what data has been provided, and if the data that is provided is skewed or biased, then the machine would learn the wrong things. The need for diversity must be emphasized as bias in algorithm outputs will occur if the input data is skewed to specific population groups. Unequal healthcare is to me one of the greatest evil that we have perpetuated in one way or another, particularly in healthcare. And it will be very, very sad if machine learning continues to emphasize the undesirable biases instead of the desirable biases when it comes to healthcare. So the digital healthcare revolution can only be advanced by close collaboration between healthcare professionals, software designers, statisticians, mathematicians, data scientists, engineers, behavioral and social scientists, and user interface designers and artists. So the goal of healthcare is, of course, for us to ensure the well-being of each and every individual and also the community and the society. So i.e. what would be considered as health for all, that would be the major mantra. And this should be regardless of creed or income status. So achieving such a goal is therefore a task that extends across broad domains and which would involve a lot of individuals and not only limited to those who are directly involved in healthcare. And I therefore encourage young minds from all sectors to join together to form this digital healthcare revolution. Okay, with that, I conclude and thank you very much for the opportunity to present in this webinar, and I'm glad to take any questions. Thank you.
Okay, thank you very much, Dr. Vera. So now I think we can go to the next session, which is the Q&A session. So anyone, if there's a question you want to ask, you can click on the Q&A button at the below, and then just type in your questions. All right. And then there will be a evaluation form as well at the chat box. Kindly click on the evaluation form and then give us some response. So maybe meanwhile we just wait for them to do the evaluation form and type some question to us. Yep. So is there any question? Feel free to type in your questions in the chat box, in the Q&A session there. Let's wait for maybe around 5 minutes. If there's no questions, then we just proceed. All right. All right, Dr. Vera, I have a personal question now.
Yeah.
So just now about the iWatch,
Uh-huh.
how accurate is it actually?
At the moment, I don't think it is certified for health use actually.
I see.
Yeah, but it is useful for certain segments of individuals, but I don't think it is has achieved that level of accuracy to be
Okay,
used.
not yet lah.
Yeah. not yet.
Yeah.
Hopefully,
Okay.
technology will continue to improve, so I think that will be the way to go.
All right, understand. Yeah, so the participant doesn't have any question. It's okay. So we just move on now then.
Okay, yeah, sure.
Okay.
Okay,
So
okay,
yeah. So thank you, Dr. Vera, for the sharing session. And let's move on. Just for you all to know that currently we are having the Cyber Open Day, Utah Cyber Open Day from the 20th March to 4th of April. All right. So what is happening in the Utah Cyber Open Day is we have a live webinar like this one, okay, and then we have video chat where you can make an appointment with the lecturer and then have a video chat with them, right? We also have a live chat where you can do a live chat at our platform there, okay, and we also have the virtual tour where you can see most of our facilities through through the platform. All right. So for anyone who is interested, you can just scan this QR code or just visit us at the website below there. Okay, utah.openday.utah.edu.my. All right. So last but not least, this is few of the ways that you can contact us. We have our websites, Facebook, WeChat, all these hotlines. You also can contact us and email as well. All right, so that's all for today. Thank you very much for joining us. Thank you, Dr. Vera.
yes, thank you very much. Yeah,
Okay, thank you very much.
okay, bye. Bye
Okay, have
then.
a nice day.